Did you know that low back pain is one of the leading medical causes for anguish among people? Nearly 75% of the population will experience at least one episode of disabling back pain. Also, 50% would have an episode of low back pain that required an alteration in activity by the time they are 30. Not only that, low back pain is the fifth most common cause for physician visits, fifth commonest cause for hospitalization, third common reason for surgical procedures, and the number one indication for surgery in people more than 60-year-old. But are all of them serious, or is a visit to the doctor needed every time you have low back pain? Well, the answer is a big no, which actually is a big sigh of relief. In fact, majority of the low back pain get better with home-based remedies. Over-the-counter pain medications can help you reduce or control the pain in its acute stage. So do cold packs, which are more useful for acute pain since they numb the area, constrict blood vessels, and reduce inflammation from becoming worse. Or a hot pack, which are more useful in recovery phase wherein they increase blood supply to the area and relax the muscles or joints. A limited period of bed rest for 1 or 2 days can also help in faster pain relief, but prolonged bed rest is not recommended. Light stretches, preferably under the supervision of a physiotherapist, can also help to get back to your routine faster. But again, home-based treatments do not work in some cases, and it's important to seek a consultation with a doctor if you have any of these. Sudden severe pain not showing a subsiding trend in 3 days, mild to moderate pain not subsiding in 1 week, any pain that lasts more than 6 weeks even if it's on and off, and pain that persists even on lying down. Post-traumatic pain or pain that persists in people more than 60 years of age, or those with associated symptoms like fever, weight loss, with a history of cancer, immunosuppression, or prolonged steroid usage. In case, your doctor will have to do a detailed examination and maybe some tests to rule out any significant underlying spinal problems. More importantly, there are some serious signs which should not be neglected, and a doctor visit should be done as soon as possible. These situations are if you have an electrical or a shooting pain in your legs, which may be due to nerve compression in the spine, any pain or cramps in the legs while walking, which could suggest reduced space for the nerve roots, a situation more common in older people, weakness or numbness in the legs, which could suggest onset of nerve damage, difficulty in passing urine or stools, or urinary incontinence, which is an ominous sign suggesting severe nerve damage and requires urgent attention. So, though low back pain is a very common condition and majority subside by themselves, the conditions mentioned above require prompt evaluation for any serious underlying problem, so that corrective measures can be taken to prevent any further worsening, and serious problems identified and appropriate treatment initiated at the earliest. Hope this video was clear enough to make you understand when it is necessary to seek medical attention. Thanks for watching.